Good afternoon, everyone. Sorry we are late today. We had a few technical issues on our end. So we are continuing with our mental health awareness chat. This afternoon we have Priscilla again. I don't know if you guys remember her. And I'm very excited to have her again. Sorry about that. I'm very excited to have her again. So Priscilla will be joining us today to educate us on personality disorders. And I have to tell you, this was very uncomfortable for me because when I went through it with her, man, I could identify myself so much in a lot of things that it was just making me very uncomfortable. So but I'm hoping that it'll be informative for you guys. Thank you again for joining us, and I hope to see you again in future with our other future broadcasts. Remember, we're doing this for the whole month of August. It's an all-women panel, healthcare professionals joining us to educate us on mental health issues. And I don't know, I've picked up a lot, obviously, from everything that they've been teaching us and the knowledge that they've been sharing with us and imparting on us. And I'm very, how do I say? I'm very worried. I'm very worried about the state of our mental health, guys. It's not just with this lockdown that is happening now and people being anxious about whether they're still going to have work or not. Some people are stressed out because they've been let go from their jobs. But I realized that it is just so much. It's with mental health. It's not just things that are happening now, because my idea or my motivation for doing this was because of us going through this lockdown and we being isolated from people. We can't be with our friends and just let out and have people to talk with and all those things. But I realized that it's so much deeper than that. It's not just things that are happening now. It's literally anything and everything. Could be things from your childhood, that could lead you in a state that you don't want to find yourself in. We've had a conversation with Dr. Mahlati the other week, and some of these disorders or conditions, you can't. It's not like flu. You don't catch it, get medicine, sleep it off, drink some water, and then you are back to being okay. Some of them you can never come back to being okay. You end up being on chronic medication or being admitted. It's really been an eye opener for me, and I'm worried. I'm worried about myself. I'm worried about everyone. With everything that we go through. But I'm hoping that the more they teach us, the more they impart their knowledge on us, the more we can be better informed and be able to avoid certain situations or be able to know how we can assist ourselves, should we find ourselves in a corner. So we've got Priscilla today. She'll be talking to us about personality disorders. Just give me a Hi, Priscilla. How are you doing today?
I'm okay, thank you. And yourself?
I'm good. I'm happy to see you. I want to tell viewers now that I'm very worried about today's conversation because going through the stuff that you said you're going to be teaching us about, I noticed a lot of myself there. I noticed a lot of myself there in some of those things. So I'm very concerned, and I noticed a lot of people as well that I know of. So
There's a bit of something there.
Yes, it's a little bit of everyone in there. No one is immune,
No,
which was
not
very
at all.
interesting. Thank you again for joining us. Please introduce yourself to the viewers who might be joining us for the first time, and you can roll on. The platform is yours.
Hi, everybody. Welcome back to everybody who's been following us. And to all the new people, my name is Priscilla. I'm a professional nurse. I did advanced psychiatry. I work in a psychiatric hospital full time. And yeah, that's that.
Can you just
So,
say that again? It always advanced something. I always mess it up.
advanced psychiatric nurse.
Advanced
So
psychiatric.
that's just like in all nursing disciplines, we have special. You have your midwifery. We have an advanced midwifery. Midwife. I'm sorry. We have a
Mm,
child nurse. We have specialized beyond the basic. That's what that's all about.
okay. Now I'm just trying to prove to them that we've got the real deal here. We got people who know what they're talking about. Thanks, Priscilla.
So today's topic is personality disorders. Um, like Noklila just said, we're going to see a lot of yourself in the 10 disorders that I'm going to talk about. So, a personality disorder is that person who's self-centered, who does things for personal gain, who do not even care about how other people are feeling, for that matter. And this is actually characterized by a pattern of unhealthy behaviors. Like these people don't actually they cannot say that they do have the disorder. That's one of the issues. Like most psychiatric illnesses, they can never say that. Have, I'm sorry, somebody busy calling me on the line.
Okay, we'll give you a moment.
No, it's fine. I will keep on hanging up. So we have three clusters, like I said, cluster A, cluster B, and cluster C. Now,
Before
in
you
cluster
continue,
A,
remember when we first our very first chat, ne? I asked you if there are any categorizations in these things,
mhm.
right? Said there aren't any mental illnesses, are just that mental illnesses, or mental health is just mental health, flat based. Why with personality disorders we've got them categorized? Is there a reason for that? Maybe are they
the, re-
categorized in certain
the reason
characteristics?
why they are put into clusters is because of each and every cluster has one positive thing in them. Like your cluster A, these people have a certain behavior. In cluster B, it's the emotions, and in cluster C is beliefs and so on and so on. So hence they are grouped into three clusters, and each cluster has different personality disorders.
Okay.
Yes. So we're going to start with cluster A. Cluster A is the one, like I said, where it's behavior is involved. They are a bit paranoid, and how they think. They are a bit odd, like what you and I would think is odd. The first one will be the paranoid personality disorder. These ones, they are very suspicious of other people and their motives. Like they don't take what you say. They even if I would have a friend and I have paranoid personality disorder, I would think this person is actually bewitching me. This person is going to poison me. This person is jealous of me. Things like that. And they would have unjustified beliefs that others are trying to harm them. Like maybe my friend has not even shown me that they have something against me, they want to harm me, but I have that belief that is unjustified. Unjustified meaning that there's nothing that my friend has ever done to me to show me
There's
that
no
they
reason
actually
whatsoever
have
to
something
going down.
against me, but yeah. And
Okay.
these people are they have issues with loyalty. They've got issues with trusting. They are very hesitant to confide in other people. Like if I have to have a personal issue, I would find it very, very difficult to speak to somebody about that issue, because I think you might tell other people, or I might see it written somewhere, and I might even use that information against, they might even use that information against me at some point. And they will take innocent remarks, sorry, and then they will take it as if I am insulting them or something like that. Like you would say a simple thing, beautiful dress, and I will, she's probably saying my dress is not really not beautiful, like you are saying. And
So
they
this
have
is
a
unprovoked at all. It's just
just happens. It's not provoked, and they actually are very hostile. They can insult you. We all know that one person who's known for this person can
they're
insult
always
you like
ready.
they're looking at the book, like they're paging from 1, from 2, from 3, and they have all the right insults to say to a person. That's a person who would say could have a paranoid personality disorder. And yeah, usually these people would think a partner is cheating on them and it's unfaithful, even though that partner has never done anything, has never been unfaithful for one, I've never seen proof whatsoever, but I have that belief that my partner could be cheating on me, if that person is unfaithful or has other sexual partners, things like that. So all of those should be unjust, all those suspicions and unfaithfulness should be unjustified. They shouldn't be proof somewhere that says, yes, this person has cheated on me before, hence now I believe that they might be cheating, or they're doing the same thing that they did when they were cheating with Mama at some point in time. So that's the
So
first.
sorry. So you mentioned that they find it very difficult to trust anyone, right? So in
Yes.
the we are busy encouraging people to seek help, speak to someone, invest in that touch time. How would it work in the case whereby it's a person of this nature? Because now if they're untrusting, they most probably won't be able to open up to anyone or the relevant people that you're supposed to get help from. So how do these people get assisted?
Hence, to treat or to manage anyone with a personality disorder is quite a difficult challenge, and it takes quite a strong-willed person, and it takes a huge amount of time to get the person to the right state. Because even if they were to come and seek help from a professional, they still think, no, when maybe you look like that person who my husband or my partner is cheating with, or you were sent by my mother, or at times they don't even want to eat the food that you give. Even if I were to offer water, they won't take it because they believe that something was put in that water. And it doesn't matter whether it's a family member, it's a friend, it's a stranger, it's a healthcare professional, they still have the same belief. But then with psychotherapy and all the other methods we'll talk about at the end, it does get to some, just get to win at some point. Though it takes forever with some, and some just at some point, if they are hospitalized, for instance, they get discharged with the same symptoms, as long as they are now able to function and all of that. Like you said, these are the people we live with, these are the people we work with, these are our next door neighbors, these are our friends, and yeah. So yeah, that was the first one, the paranoid personality disorder. Then we've got
Thank
the
you.
second one, which is the schizoid personality disorder. Now, with this one, they lack interest in any social or personal relationships. These people don't want to engage in personal relationships or having friends. They don't want to socialize. They prefer being alone.
Sure.
And the
That's a
reason
good
being is
way,
that not really because for us to say that you have a personality disorder, this disorder should be disturbing your whole life. But now, at some point, I prefer to be alone, but there will be a time that I would want to go out with my friends. Then that does not mean I've got a personality disorder. I do talk with people on WhatsApp, and so for now, you are still off.
Hallelujah. Okay.
And these people, they tend to have a very limited range of emotional expressions. They cannot express their emotions. Whether they are angry, they're sad, they are happy, like they have this face. Whether they are happy, you can see. Whether they are sad, you can see. They have this dull, blunt face that you can't even say today whether they are happy or they are sad. They would probably be telling you something sad, and their face would be like, there's no
You're not certain if you should sympathize with them or
yes.
yeah.
They're sharing that now I just bought a car, they should be happy, but you can't see it in their face, things like that. And they are unable to take pleasure in most activities. Whether is it going out or going on holidays or watching TV or listening to music, the basic things that people do on daily basis to entertain themselves, they do not find pleasure in those things. And they are unable to pick up normal social cues, and they appear to be very cold and very different to other people. You would say, and it's not really that this person or just that they don't know how to act. That's just how they are. And they have little or no interest in having sex with other people whatsoever. Yes. Isn't it that if you were to have issues with having relationships, then yeah, we all know that sex and being intimate actually follows. So that's the second one, the schizoid personality disorder. Then we have the third one in cluster A, which is schizotypal personality disorder. Now, their speech, their behavior, how they dress, you'd even think ghost-like maybe, or they prefer wearing old vintage clothes, things like that. Like things that you think this is not normal for a 25-year-old to wear, or a 16-year or an 18-year-old to wear. Or even a 50-year-old would be even wearing skimpy, things like that, and you'll be thinking, this person is wearing like a 15-year-old, but like they do not have that thing. And they will sometimes hear things whispering into their ears, whispering their names. And they also have flat emotions, inappropriate emotional responses. Like I would tell you that we lost a classmate, and you'd be like, okay, I don't expect that was our classmate or probably our friend. I would expect to see some facial expression or you to say something, but you're saying, okay. That's when you're saying that is flat. And they have social anxiety. They don't want to be in social groups or social friendships. And they also lack comfort with those friendships. So they find it very hard to form friendships or to maintain them. They are very indifferent. And they have this magical thinking. Né? They will believe that they can influence other people and thoughts. Like we spoke about it in schizophrenia, that in schizophrenia or psychosis, they would believe that they are the it. But now with schizophrenia, it's a chemical imbalance. That it's something that is actually telling them that that's how it is. Now, with a schizotypal, that's why schizo for schizophrenia, schizotypal personality disorder, they have that strong belief that the reason why you are wearing that wig is because of I'm wearing the same wig. the reason why you are sitting on the chair is because of I told you to wear the chair, or are unable to influence your thoughts, unable to influence events, or I'm the party. Without me, there's no party, things like that. And they believe that certain casual incidents or events, like if they are not there, then it's not happening. So that is cluster A, which has three types, which is paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. So before we move to cluster B, is there anything I should clarify?
No, I'm just saddened because I'm thinking now, having someone like that around, just as a family or colleagues or whatever, associates around. I'm just trying to imagine how difficult it can be, right? Or like it can be such an inconvenience, and it's sad because you would feel that this person is being unreasonable about certain things, and then you would react in a certain manner. Okay, which now a question will come. Now, say a person is just being funny towards me, that they just don't trust me. They look at me and they've got these things in their heads that, oh, she's wearing the wig because now I'm also wearing a wig, and they're just being funny towards me, and I react. Well, obviously I will react as a human being in a particular manner. Does that make the situation worse? Does that affect them negatively?
Not really, because of what they believe is what they believe. So it does not even depend on how you react. I might tell you no, but I'll still do it anyway. I'll still feel how I'm feeling anyway. And that belief, it's that, hence it's personality, it's who I am. It's my in my makeup, in a way, you can
So whether
say
you react or
that.
not, whether you feel that way.
Yeah, that's just how it is. Unless it gets severe and we then go to the treatment methods, which we'll do towards the end, which, yeah, yes.
Okay. All
So,
right. From me, no question from our viewers either. So you may continue.
okay, so we've got cluster B. Cluster B has 4 personality disorders, which is the antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and then narcissistic personality disorder. So now with the antisocial personality disorder, they do not disregard other people's feelings. They don't care how you feel. I will say whatever I want to say. When I say it, I will do what I want to do whenever I want to do it, and I don't care how you feel about it. Whether it affects you, whether it saddens you, whether it makes you happy, whether it makes you sad, I don't care. And these people are persistent in lying. They steal, and they usually con others.
Okay.
Yes. So they will usually find themselves in problem with the law. They have recurrent issues with the law, probably from the stealing, from the lying, from the conning of other people, and so on. And they repeatedly violate other people's rights. Like I said, they don't care about anything. They do what they want to do at that time, so they don't care about other people. If it means I wanna slap you at that point, that's exactly what I wanna do. Whether you open a case and I get in trouble, that's not my problem. And they then are aggressive, very violent, and yes, and they disregard the safety of others or even themselves. They can get themselves into issues that can get them into trouble. Like I can somehow meet a person and tell the person how I feel. That alone can lead a person to attacking me or something. I don't care about that. As long as I tell you what I want to tell you at that point, I'm cool, I'm fine. And they have an impulsive behavior. They just act. And then whatever comes out, comes out. They don't filter, they don't have filter in a way. They say it as it is, as raw as it is, Whether we see it as being vulgar, we see it as being a 17-year-old speaking to a 45-year-old. It's not about them. They don't care about that.
Yep.
And they are constantly irresponsible. You know, every little thing that you think it's irresponsibility, whether you'll be drinking and driving, whether you'll be drinking on the street or whatever, they will do that. And they also lack remorse for behavior. They are not remorseful at all. So I will do something, and then you tell me that you had my feelings, you said 1, 2, and 3. I'll still have no remorse whatsoever. Things like that. And the second one is the borderline personality disorder. With this one, they are impulsive and risky behavior, such as they will have unsafe sex, they will gamble, they will binge eat, they do all these behaviors that might be at risk to themselves. We know at this day and age, going around having unsafe sex, or you gambling, you sorry, you binge eating, like the fridge is full, why not? Let me just eat it for whatever reason. Then they have a very unstable self-image, how they see themselves, how they perceive themselves. It's very unstable. 1 minute they'll say, I am Miss South Africa. One day they are down. So yeah, that's very unstable. And then they also have up and down moods, of which these moods at times they can be a reaction to some sort of stress, or something like that, but they are up and down, of which more of moods will be talked about when we are doing mood disorders in detail. And they usually have suicidal behavior or threats. If they don't get their way, they will tell you, I'd rather kill myself, or they will cut their wrists and all of that. They have a very huge, intense fear of being alone or being abandoned. As different from the one with paranoid. The paranoid, they don't want to be around people, they don't want to be in social relationships, but these ones are now afraid of being alone. They are afraid of, let's say, my friend. If I would have a feeling that my friend will stop being my friend, or my partner would leave me for whatever reason, they are afraid of that. And they have a very ongoing feeling of emptiness. They feel empty half the time. Hence, they frequently they display their anger however way they can display their anger. And stress, they usually have stress-related paranoia, which comes in groups.
Okay.
Yes. That's the second one on cluster B. Then we've got the third one, which is histrionic. With this disorder now, the histrionic, like it's saying, like you overly, something like that. You will constantly seek attention. They are excessively emotional. They are dramatic.
Okay.
Sexually proactive, or to gain attention. Like if it means I have to walk with my breast out and all of that, walk all funny, just to gain that attention. And they speak dramatically with strong opinions, with no facts whatsoever to back them up. And these people, they're easily influenced by others. I would see you do something or wearing somehow, and tomorrow I will try it, because they're easily influenced. They are shallow. Emotions are rapidly changing. They don't stick to one type of emotions. They rapidly change, so on. And they are concerned more about how they look physically. They'll probably move from, they want that extra inch on the bum, they want that flat stomach, they want that size B to go to a D, and I would wake up and the first thing I would do is wash my face, put on makeup, put on my lashes, put on my hair. Otherwise, I'm not going to go outside, things like that. But like people should not confuse that there is a line between just
it's okay when it's
being
excessive.
clean, but when you are doing it overly, I wouldn't answer your video call if I'm not wearing my wig and I don't have makeup on, because I'm very concerned of how I look physically, isn't it? And they think relationship with others are closer than what they really are. I will tell you that I'm friends with Kanye Bao, for instance. I'm not friends with Kanye Bao, but I would believe that, or maybe at some point I saw Kanye Bao, I was sitting next to her, we took pictures and all that. But with me, I would think that we actually friends,
Best friend.
Yes. Then the fourth one in cluster B is the narcissistic personality disorder. Now, these ones, they feel that they are more special and more important than everybody else.
Okay.
They love power, they like success, they like to be attractive at all costs. And they fail to recognize other people's needs and their feelings while they are going for that power, for that success, for that attractiveness. They don't care about other people. And they are very arrogant. They are unreasonable because they want to do what favors them. There isn't a point where you say, sometimes I would want to go see, we go into the movies, I want to see one and you want to see the other. I will never compromise. It's either me or not. It's either we are watching my movie or I'm going back home. Instead of us sitting down saying, how about we watch this one now and then we'll come again next to go tomorrow, watch the other one, or we'll watch the other one after the next. But it's not about that. It's about what I want at that point. It's either that or nothing at all. And they envy others. And they believe that others envy them. So that's cluster B.
Sure.
If there's no questions with cluster B, I can move to the last cluster.
I got a question because I'm looking to you and I can see a few of them connecting one way or the other, right?
Yes.
Let's say about being empathetic, there was one that you mentioned in cluster A whereby the person would be maybe a con artist or whatever the case, right? And like we know about these people and we'd be thinking, but let's all guy, workers and whatnot. And then there's another one that you mentioned as well in cluster B. The person is just not empathetic at all. Like, how do you then, as professionals, how do you manage to be able to tell which is which? Or I need to be an advanced.
No, not really.
Because
we do have
so many similarities that ordinarily I don't know I would miss them around maybe. How are you able to diagnose that this is what this person is dealing with?
that I was gonna talk about when I'm doing the diagnosis. But anyway, when we are doing the diagnosis, isn't it? We sit down with the patient or the client at that point, and we have questions. It's a sort of an interview. Now, we have what is called a DSM-5. In the DSM-5, it's a way in which we diagnose in psychiatry. All psychiatric conditions go via the DSM-5. Now, you mark, it will be like some sort of a questionnaire that you mark, what is more evident, what is less, what is more evident would say you have an avoidant personality disorder, or you have a borderline personality disorder, or you have a dependent personality disorder. So that will all depend on the severity of that, because probably there's only one thing, or that one symptom that is actually present in all of them. But you having that one symptom does not mean you have all of them. It's not possible. So we're going during that interview, we're going to look at how many of the questions do you score high for or low for. Then we're going to know that this is actually an avoidant one. This is actually an obsessive compulsive personality disorder, and not just schizoid type and things like that. So yeah, that's how you differentiate.
I've got another question with
Okay.
chronic personality disorder. How easily are these people influential on others, right? Because now I can understand they are easily influenced, so to say, because they seek attention. Whatever is trending now, they most probably want to do it. But how easy is it for them to be able to influence others as well around them, to say, hey, look, there's something that is not up our nostrils, they're gonna wanna try it because they're probably doing it for whatever reason, seeking attention. And then how easy is it for them to influence others around them?
As individuals, we know that we look at trends. We look at your favorite artists, what they do, and you want to do it. That dress that I was wearing the other day, I would want to. So now, just like any other person who does not even have a personality disorder, I will see something that might sound like this is me, and I would want to try it. Even if it's not snorting, maybe dressing in a certain way, and I saw it, I like it, and I will do it. Not because of I've got a personality disorder, but because of I saw a person, unfortunately, who has a personality disorder, wearing the same dress or wearing in the same way, or doing the same things that I might want. Or this person probably is doing now netball or is going to gym, and I love how they look. I might even join the gym for that because I love the end product. I love how good it, because they will sell things to you. They will make you believe that this is actually the good thing, the real thing, the best. There is nothing like it. And all of us right now, we are probably drinking some concoctions, want to lose weight because we saw how sexy a certain somebody looks, how nice they look in a dress, and so on. And we go ahead and do it, even though we do not have any personality disorders.
Okay, thank you.
So we have cluster 3, C, which is the third one. Cluster C has 3 personality disorders, which is the avoidant personality disorder, the dependent personality disorder, and the obsessive compulsive disorder. Now, with the avoidant personality disorder, it's exactly that, avoidant. So usually most of this 10 personality disorders, the first wedding before the personality disorder will actually lead you to have an idea what is this personality disorder all about. So now with the avoidant, they are too sensitive. They are afraid of rejection, criticism. You will tell me that probably you're going out and you tell me, but that how that dress is too light. How about you wear something inside? And I will so much just go into my home because I do not want criticism. I do not want rejection. I'll feel like there's some I'm being rejected or something like that. So that's how the avoidant personality disorder people are. They feel that they are inadequate, they are inferior, they are unattractive, of which These are much similar to symptoms in your bipolar mood disorder when they are depressed. But now this one is a personality disorder. That's just how they are. They avoid work at all. Any work that I prefer, like at the moment, I'm talking to you via StreamYard, the best for me. I rather work via email, but any work that wants me to have personal contact, that I do not want. Maybe that's because of they fear criticism, they fear rejection, so they prefer to be on their self on their self while they are doing their work. They are socially inhibited, they are isolated, they avoid new activities. You can tell me, let's go hiking, and I'll go like, because probably in hiking I will meet new people, I'll meet new
I had
strangers.
to
They
like
don't want to
that,
meet
yes.
new people, and they are too shy, yeah, in social situations and personal relationships. I'll still be sitting with my boyfriend, and I would be thinking, what if he's looking at my nose? What if he's looking at my eye? What if he's looking in my ear? And things like that. Because I fear disapproval, or I don't want to be embarrassed, or I don't want to be ridiculed for that matter. So that's the avoidant personality disorder. That's the first
Okay.
personality disorder under cluster C.
Okay.
So we've got.
If I'm understanding your explanation, this will
Mhm.
probably be the first one of all that you've mentioned that actually has an underlying factor as to why these people are like this. You know, they avoid people because they're afraid of being rejected and they're afraid.
Yes. Mm-hmm.
Am I right? Is this the first one that actually has an underlying factor as to that justifies why they they are the way that they are?
But in a way, it's not justified because I've never been criticized. Maybe, for instance, I've never been ridiculed, but I'm just afraid of rejection. But I've never been
Mm,
rejected, so it just happens. Not necessarily that I would, I would not want to form relationships because I don't want to be embarrassed. But it has never even happened to me. But I'm just afraid of it. Yeah.
mm.
So that's the avoidant personality disorder.
Okay.
So
Thank
we've
you.
got the dependent personality disorder. These ones, they are excessively dependent on others.
Okay.
They have an extreme need that they need to be taken care of. They are dependent on other people. That's just straightforward, the simple way of saying it. They appear to be very clingy, very submissive. Isn't it that if I want you as my friend to just be my friend. Whatever you say, I will do it. Whether, I will be submissive, I'll be clingy towards you. If I see you with other people, then I'll have a problem. Uh, I'll be angry because if I saw you with another person. Because we are adults, we know that I have friends, but we're also friends. But that doesn't mean you also must not have your own friends. But immediately, if I see you with somebody else, and then I'm like, then you can see that this person has actually some dependent personality issues. Because I cannot do anything on my own. I want somebody to hold my hand, of which is a bit different with I'm trying something new, and I would want somebody who has gone through it to go through it with me. But it's different
Mm,
when I don't even want to try. You would tell me you want to try, you want to start hiking, for instance, and I would say, I will only do it if you are with me. I won't try it with anybody else. You know, that's where the dependent issues are, and they can never fend for themselves, even if they're given the opportunity. They are reluctant to self-care, basic self-care. They're
and we're
unable
talking
to.
about adults here, ne?
Yes, we're talking about adults. They lack they don't have confidence. They, I want excessive advice. I'll ask you, I want to try out, I'm going out on a date. And you will tell me, no, it's fine, you can wear this. But I will still ask, when he says hi, what am I supposed to do? And what if he offers me water and I want juice? Things like that because I'm unable to do it by myself. I want somebody to walk me through it. Even if it means I will WhatsApp you during that same date to ask you, he just asked me what I like. Because I'm not sure if I were to say, I like chocolate, if that's enough. I want somebody to tell me that you maybe love strawberry, not chocolate. Even when making small decisions, I would want to consult with somebody, if whether I want to cook chicken or beef tonight, I will ask somebody, should I cook chicken or beef? And then if you say beef, I'll go with beef, yes. Now, these people are unable to start any project whatsoever on their self due to the fact that they lack self-confidence, isn't it? And they do not disagree with anyone because we fear disapproval. Because even if you say, let's go left, I'll go left because I will know that left, it's the long drive. How about you take? I will never raise that issue because I don't want you to disapprove. Whatever you say, I'll go with it. It's fine. Let's do it. And
Sure.
they then can stand abusive treatment. They can tolerate being abused because of they don't wanna be outside. I rather stay with you whether you abuse me or what, it doesn't matter because I'm very comfortable with you and all of that. So I will be very tolerant to the abuse. And whenever they need to start a new relationship, I will start a new relationship. I will end a relationship today and I will start the next one tomorrow. There isn't where you say, there's an urgent need because I cannot be on my own. I don't know Priscilla as Priscilla. I know Priscilla as Mama. I know Priscilla and whoever. So they tend to jump from one relationship to the next. Easily so. Not because probably the opportunity presented itself, but they can never be alone. They want to belong with somebody. They want to be to somebody who appreciates them, who tells them they love them, and things like that. Then we've got the third one and the last one, which is
Sorry, Priscilla, I just have a question on that one, right? So okay, this goes for this one and probably the others as well, right? So these disorders, is it just a disorder that you would naturally have, or can they be built on by certain factors in our lives or even people? Because I'm thinking now when you mentioned that that person would just be with you through whatever, so long as you just have that person nearby, because they don't want to be on their own. They probably won't be able to function on their own. I'm thinking about comments that we would usually hear when there's a case of domestic abuse, and then people will come up in an uproar and say, but why is she only mentioning it now? They've been together for 4 years, or they've been together for 12. Only now she's mentioning it. Could that maybe be a factor somewhere in there, that this person might have this disorder, that they're with this person, regardless of what is happening, regardless of the hostility in the relationship, but just to have that person around, because they don't want to do anything on their own. They need this person to validate each and everything.
the existence. No, not really. But I was after this obsessive compulsive disorder, I'm gonna talk about the causes and the risk factors. But with that one, staying in an abusive relationship sometimes is not really because of you have a personality disorder. We as human, we tend to have positive thoughts about others. You met this person was not abusive from day one, and you dated, and this abusive trend just started while you are now in love with this person.
You're still enjoying the
They
moment.
mostly You stay mostly because of you think they might change, or they are being abusive because of you did 1, 2, 3, or they're going through whatever at work, and as soon as that challenge their way through, they will be okay. Or probably they are being abusive because of they will be drunk, or you will make excuses, but that does not necessarily mean the person who stays in an abusive relationship
Okay.
has a disorder, though it plays a huge abuse does. It's a risk factor for a person to have a personality disorder.
Okay. Thank you.
So yeah, the last one, which is obsessive compulsive disorder. Um, this you are obsessive. You want things done the right way. If you you don't want it, you want it ironed and folded in a certain way. You want cooking to be done in a certain way. There's some ordinance, some rules that you abide by, and there's some extreme perfection, and you just want everything to be perfection, so perfect. And then if perfection is not achieved, then you leave that project. If it does not meet your standards, then you leave it. We know there are those people who, if you open their wardrobes, you will find white in white, pink in pink, yellow in yellow, color in color. But you find some of us, t-shirts go one side, whether it's white, pink, maroon, or whatever, they go one side. We don't care about that. It's not that orderly. But then with these people with obsessive compulsive disorder, they have a way of doing it. Even if I were to wash dishes and then I have to dish up, you're thinking, no, a normal person will just take out the dish and dish up. But a person who's obsessive will think it's dirty, and they will rinse it again and take a clean cloth and then wipe it. And then even if before they eat, they will sit in a specific way, and then wipe everything else, put handkerchiefs if they need to, and then eat in a certain way, not eat and not haphazard, how we do things, and it will be a mess all over. They also desire to be in control of people, whether it's things, and they neglect enjoyable activities because of they're so committed to something else. You will tell me, let's go out, or let's go watch a movie or something. I will say no because I'm still busy with whatever it is I'm doing. Though that thing is not really true, but I will never say no to it until the particular task is finished. And
No compromise.
very stubborn. They're inflexible about their morality, their ethics, their values. They're usually different from your day-to-day people. And they have very tight control over their budgets and spending money. That's a person who would have a pen, and before I buy sugar, I will look at 5 types of sugars, 5 shops before I even go shop, and then write it's $3.99 at this shop, and it's $4.99 at this shop, and it's $3.49. I'll definitely go to the $3.49 because I have a tight budget. Not that I don't have the money. Yes, but that's just how it is. You want things to be done in a certain way. You want things orderly. And even if I were to be shopping, I'll be pushing my trolley, and you find some people would put mayonnaise, and then they would put fruits, and then they would put biscuits, and they would put with them. Their trolley is quite neat. Kitchen stuff will be at that far corner, your milk products will be on the other side, your fridge items will be properly, stacked on the other side, and so on. So yeah, that's the obsessive compulsive disorder. So like I said, we have 3 clusters, which is A, B, and C, and then there are 10. Cluster A has 3, cluster B has 4, and cluster C has 3, which makes them 10. Now, going to the causes, like most mental illnesses, the genes play a part. Certain personality traits, they are passed on from parents. Because it was passed on from one generation to the next. And they don't know how to speak to people. They can swear to you like nobody's business because their mother used to do that. So usually we are saying it's passed from one generation to the next. Even your environment, like all the Anna, it will involve the area you grew up in, the events that occurred. And most personality disorders are caused by a combination of whether it's the genes or the environment alone, or the genes alone. Yes. So now the risk factors would be family history. Like I said, your genes. Hence, when we sit down and we interview, the most important question would be, is there anyone in your family who has suffered 1, 2, 3? Because we want to establish that there is no family history of mental illness, whether it's any other mental illness or personality disorders. Because usually if they were to ask me if there was somebody with mental illness, I say, but I won't know which diagnosis was it or whatever. But I say, that alone at least will give us a clear picture. Even if we'll need to probe, we'll probe and ask, if what was that person doing? Then we will then gather what illness was it. Being in an abusive, a very unstable, and a very messed up family during your childhood. Hence, when a client comes in, you want to know about their upbringing. Not because of you want to mock them, because of they were raised by a single mother, or they were raised by a mother who used to drink and beat them and all that. No. The reason being how they grew up, the abuse, the unstableness in that family, the upbringing plays a huge and vital role on how you turn out as an adult. They will say, we know that every family member, it's so normal that you can't even go astray. So, and also being diagnosed with a conduct disorder from childhood. We know usually your ADHD, conduct disorders, which we diagnose the young ones. So a person
which we still need to talk about.
Yes, which we still need to talk about. There's a huge, because at this program you would see that it's stating, like I saw a video this one time, what looked like a below 10-year-old was pushing things, that anger, that outburst, that probably part of the conduct disorders that we need to look at. And like any other mental illness, the variations in your brain chemistry and the structure will then will be your risk factors. Not necessarily mean a person diagnosed with a conduct disorder will have a personality disorder, or that I grew up in an abusive family or a very messed up family I would have. But these are risk factors. This is what predisposes me to having the personality disorder. Now, how we diagnose...
It's not a baseline to say that if a person is brought up in that environment, then it's certain they're going to have some disorder.
No, not at all. It's just that it's a risk factor, it predisposes them to having it. Okay. So now with diagnosis, if you then suspect that somebody has a personality disorder, this is how we look at it. We do a physical exam. The reason why we do a physical exam is that we want to exclude any medical issues, any head traumas, any use of substance abuse. Because we, like the other time we talked about the impact of the using of substance has on your mental well-being. Even in diagnosing any other, actually, to be honest, diagnosing any mental illness, we then have to go through this. We need to know, are you abusing alcohol? Are you using dach? Are you using any drugs? Are you using yoga? Are you using your heroin or whatever? And have you ever had an accident where you damaged your head, or any mental health problems at that point, especially for personality disorders? Because we might, if we don't exclude your bipolar mood disorders, we might say you have an antisocial personality disorder. Can't you actually have bipolar? Hence, we need to exclude all other, whether medical or psychological issues. That's why we do a physical exam. Then we've got the psychiatric evaluation, which is the interview I talked about earlier on, where we sit down, we discuss your thoughts, your feelings, your behavior. And it can be done in a form of a questionnaire where we pinpoint. And then with your permission, we can get in a family member. Because sometimes you don't see the things that you do, that they are a problem. So having a family member would say, something you said no to, a family member will say yes to, because you thought it was normal for you, and people around you actually see that this is not it. So hence, it's very important to actually have a family member who would come in and we interview, and it's very helpful. It helps. Then the DSM-5 I talked about, that's the diagnostic criteria used in psychiatry. All psychiatric issues go through the DSM-5, because the DSM-5 is just a table that says you should have this for 2 weeks, you should have this for 2 weeks, you should have this for 2 weeks, and this shouldn't be there, this should be there. That's when we can say this is bipolar. You should have 1, 2, 3, 4, and this is a personality disorder. You should have 1, 2, 3, 1, 2, 3, and this is just your simple schizophrenia, things like that. Yeah. Any questions before I move?
Yes, we do have a question for you from Kelebogile Mpale. She says, may you please explain OCD as a personality versus anxiety? Like, when is it a personality disorder and when is it an anxiety disorder? Let me just put it up there so you can see, in case I'm not explaining it properly.
Like I said, OCD, obsessive compulsive behavior, is you wanting things done in a certain way. You're not anxious whatsoever. You don't have that thing inside you that scares you. Like we talked about anxiety the other day, and with anxiety, you are afraid to do things because of, yes, but with obsessive compulsive, you just want things done straight and narrow. You want things done your way or the highway. Perfection, you strive for perfectionism in OCD. While in anxiety, it's a feeling. You feel it. You then I would probably not want to open the door without see that person, because my heart will race. So with usually anxiety, they feel physical symptoms happening, whether it's butterflies in the stomach or those kind of things, to say it's anxiety and not obsessive. So there are two different things whatsoever, because with obsessive compulsive, it's how you want things, and you can even, that's how you want it. You want it. And with anxiety, it just happens. You are scared of this and that, and you actually even have physical feelings that come out to say it's anxiety.
So with OCD, if I now want things to be done in a certain manner, pegged in a particular manner, and they're not, would that lead me to anxiety? Would I now get anxious? Oh my gosh, no, they're not pegged correctly.
Not really. It could happen, but it's not half the time. Like when we are writing an exam, or even before the live stream, you would have like, will things go well? You just be anxious, not exactly being it, calling it anxiety, because anxiety will then be a diagnosis and a whole lot of big thing. Like, I'll just be anxious that if I don't do it myself, then it don't turn out right. Yes, you'll be anxious, but that does not mean it's anxiety.
Okay. You also mentioned that people with OCD, apart from them just wanting to be able to control things, they also tend to want to control people because they want things around in a particular manner. So they will expect these people to also do these things in a particular manner, or these people to be in a particular manner. How extreme can it get? How extreme can they be controlling on other individuals around them?
You wash the dishes, I come and rewash them because of you just didn't do it correctly. They might be clean for anybody to come and eat on them, but you just didn't clean it in a circular manner that I would want it to be cleaned, or rinse it 3 times with under running hot water. But when you rinse it, you just put in water and then you rinse it, and then that's how you then affect other people, because then you will keep saying, no, that's not how you do it, that's not how it's done, do it this way. Even when you are a simple thing, you'll be cooking or you'll be driving, and I'll tell you, before you indicate, you must check left, right, and you did that. But with me, I want it done in a certain manner, and we are doing it in a certain way. And you're probably not sitting upside down and say, no, you don't drive while you are bending. That's not how we do it, because that's how I want it. It works for you. You driving while bending works for you. Me driving while I'm sitting upside works for me. And then I would want you to do exactly what I did. That's how I will influence others.
Sure. Okay, so say I'm diagnosed with 1 or 3 of these disorders. Is there hope for me if I do come across people or in your profession? Is there hope for me?
Yes, there is hope all the time. Now, with treatment, for a hospital treatment to be rendered, the disorder should be so severe that you cannot take care of yourself properly. You are in danger. You can either hurt yourself or hurt others. Then we will then want to have you admitted. But usually it's not the case. We can see you as an outpatient. You can come in on a certain date, and during the treatment plan, what we do is, in psychiatry, we have what we call an MDT, multidisciplinary team. The reason is a psychiatrist or a psychiatric nurse or a psychologist alone, they cannot manage one condition. You need a psychiatrist, you need a psychologist, you need a psychiatric nurse or trained nurse, you need a pharmacist who would at times issue medication, you will need a social worker to attend to any social issues that you might have. You will need an occupational therapy, which we use so much in psychiatry because of you might not be able to do your self-care. They come in and attend to reteaching you how to do certain things. So when you have mild symptoms and you are well controlled, you may need treatment from just a primary doctor or a psychiatrist or just a therapist. But if it's not possible, then we then bring in other disciplinaries. But then bringing other disciplinary, the more disciplinaries we bring will depend on the situation you are facing at that time. There might be no need to bring an occupational therapist because of you are just an obsessed kind of person. You are not neglecting your self-care. So we don't need to bring an occupational therapist to come in and attend to the self-care issue. But most of the time, with all these disorders, psychotherapy is vital, is most important. Psychotherapy could be done whether with your psychologist, or most psychiatric nurses are qualified to do psychotherapy. So now that's when you learn about your condition, you talk about your moods in a very environment that is not judgmental. Because if I were to talk to you and I think you're judging me, but now in therapy, I get to express things that I wouldn't say to my mother, things I wouldn't say to my friend. And in a very, I'm saying it to somebody who understands. And this psychotherapy can be done either as an individual session, one-on-one, the psychologist and the patient, or in a group therapy. Group therapy can be done with a psychologist as the leader and other people who suffer from the same issues. That's where group therapy usually happens, where you find people with the same condition who come in together, probably on a Tuesday, sit down and we talk, and I will say how I manage my own things. You also talk about how you manage somebody else's, and that's when how we actually assist each other. Or we can have sessions that include family members, because of isn't it that you are living with your family or your partners or even your friends if need be. And these are the people who are spending the most time with you. And the sooner they come in and understand that not that when you just want things done your way, not that when you don't have filter, not that when you don't care about other people. The sooner they understand that this is what you're going through, they can better help you, they can better support you. And instead of you saying, but probably but you're afraid to say it because I know she has started. So now, the sooner we bring in family and friends and whoever you might want to come take part, the sooner the people around you understand your condition, the sooner they can better understand you. Because I don't want to say something and they say, but she has started, because they don't understand. But if they understand, they can, better support me. Hence, family therapy will provide support, they will provide education to help dealing with a family member that has a personality disorder. And with most, if not all, psychiatric conditions, we have medications that we use. So now, don't go to any group and ask, guys, I am feeling this and this and this and this, and then they ask you, hey, I have what, I'm selling what, I'm selling what. No, you go through anything that was approved by the Food and Drug Administration. That's very important, because I'll probably be on antidepressants and I'll be taking a herb. That herb probably has interaction with that thing, and I'll be surprised that I'm not getting well, and I'm asking myself, but I'm drinking this medication, but it's not helping. And when you also are taking some things that are not approved whatsoever. So now, while treating personality disorders, we make use of antidepressants. These antidepressants are very helpful in helping when you have a depressed mood, when you have anger issues, when you are very impulsive, when you are irritable, or you may feel hopefulness, like I said. So antidepressant will then help you dealing with that issues. Then we've got mood stabilizers. The mood stabilizers, like their names say, they stabilize the mood. That person with mood swings, that person with irritability, with impulsivity, with aggression, it will help stabilize their mood. Then we might also at some times have antipsychotic medications, which may be helpful with symptoms which include you losing touch with reality. Like when I said you are hearing, somebody whispering in your ear, that can help with that. And some with this personality disorder do have some anxiety, symptoms there and there, and your antidepressants will then come in and help. Hence, we then saying anxiety medication are very helpful, especially when you are agitated or you probably have insomnia. Probably you're not sleeping because of these symptoms you are feeling. Then we will give you either antidepressant or mood stabilizers or antipsychotics, whichever is appropriate at the time. Sometimes we might give you 2 of each. Sometimes just a mood stabilizer will work. Sometimes you might need mood stabilizers and some antipsychotic if need be. So treatment will come however how you present at that time. And we then have the coping and the support. Now, having a personality disorder makes you a very hard person to engage in activities, or you may anything that might make you feel better. So now you need to ask all the time, or when you come in to consult, we need to talk about coping mechanisms, because you might not want to feel like today I need to go. Today is the 17th. I need to go for my appointment, but I don't want to see people. So you need to have that thing inside you to say no. I need to attend, I need it, this is me. Or you need a family member who will remind you to say, but on the 17th, isn't it your follow up? Isn't at least when somebody goes with you or reminds you, you then
Support,
go.
support, support.
Yes. So now when a loved one is suffering from a personality disorder, whether it's at work or your friend or however, they need to see a mental health professional to find out better ways to do it. We don't do home remedies. We don't. Sometimes talking about it alone is not enough. Hence, it's very important to come speak to somebody who's qualified, who will be able to help you with the distress you are experiencing. And some people don't have boundaries, like I said. They will help you setting up those boundaries, self-care strategies, or wake up. The first thing you wake up, open your windows, brush your, those things like that, so that you can start to enjoy what you can do at home or your lifestyle. Basically, you can be a very active participant. You are the number one. You are the first person you needed in you getting better. Because we might give you a date, come on the 17th, but if you don't come, then it's something else. So it's very important that you don't skip therapy sessions. Even if you don't feel like going, you need to drag yourself there. It will come to a point where you just wake up and you go. When things go, get better. Isn't it when you are still clouded, when you're still not into therapy, into medication, then you don't want to go. But the sooner you drag yourself, the better. And then you need to take your medication as directed. Even if you're not feeling well, you don't skip your medication. And if you have other symptoms that you don't like, maybe side effects, for instance, get through with your with your healthcare provider. Tell them that, because most people will not drink mood stabilizers because of it's making them eat a whole lot and making them gain weight, which are some of the side effects. How about instead of you stopping the medication, talk about it with your healthcare provider. Find ways on how you can make it better work. Then you learn about your condition. Education, education, education. You empower yourself. If you go to a healthcare provider and they do not have pamphlets, it's fine. They can refer you to even the groups. They emphasize education. They tell you about what you're going through, what are the signs, what are the symptoms, what are the symptoms. And it's also very important to get active, because we know that many symptoms such as depression, your stress, your anxiety, and all of that would want you to just be active and feel good about yourself. It also helps you feeling good about yourself, so you need to engage in activities that will counter the effects of that. Probably I feel like I'm not beautiful, and if I get active, I look a little bit, I lose a few pounds, and I look now I feel like I'm a bit sexier. That will help in dealing with that. And you need to avoid drugs and alcohol. Like most medications, we say don't drink alcohol, like your antibiotics, you'll be drinking antibiotics and they'll say no alcohol. But at least with antibiotics, just for 5 days or for 7 days, so it's not a transmission. But with this one, you need to avoid all alcohol and street drugs as they can worsen the personality disorder symptoms. And then add something incorrect with the medication you are taking. And the most important, you do not neglect checkups. Your follow-ups, you don't miss them. If you have you are busy on the day, reschedule or go before. There won't be a problem if your appointment is on the 18th and you come on the 15th. That's good. That's actually saying, I'm involved, I want to get well. Instead of you, I'm busy, I'm not going to go and you miss 2 months. The symptoms will come back. If the symptoms come back, they come back and you relapse and things don't go well for you. You then lose loved ones, because nobody wants to sit with a very impossible person, a very stubborn person, a person who, you then lose out on relationship, you lose out on family because of how you behave. So the sooner you adhere to medical treatment, the better. So yeah, that's just about it.
Thank
on
you.
personality
We've got a
disorders.
question here from Given Carlo. She says,
Okay.
how do you know if someone is healed? That's after taking medications and or classified as a chronic health issue. How can you tell that eventually that this person is healed, they're off their right now?
Oh, unfortunately, you can never. Okay, the biggest mistake most people do is that I go in for therapy, I'm on antidepressants, and the symptoms go away. I stop. There's no such thing. Immediately you stop the medication, immediately you stop the psychotherapy, the symptoms will come back. So yes, it is a chronic condition. They might maybe taper down with the medication if you're on high dose. Maybe if you're on 60 milligram of something, take it down to 30 and 20 and things like that, but not completely off. Because of should you be completely off, the symptoms will come back. And if the symptoms come back, it means you have relapsed. So there is no cure whatsoever. We just manage. It's okay if you missed it today because you probably left and came back home late and you slept. It's okay. But the following day you make sure you take your medication as exactly as prescribed. If you miss your psychotherapy this week, attend it next week because it's very vital that you do so. So no, you can never say you are healed. It's not like your flu that will go away. It's not like your anything that needs antibiotics and you get healed. It stays, but it's so much controlled with medication and psychotherapy.
Okay. And then Priscilla, how do you, as medical practitioners, balance out all these the coping mechanisms and the medication? How do you balance them to in order to make the patient more comfortable, in order for them to be more persistent? Because I've spoken to a few people who are patients and on medication, but what they tend to do is that after a certain duration, they wean themselves off the medication because I'm feeling better. I'm doing much better than how I was 4 months back, and then they completely wean themselves off the medication because they probably believe that they can cope at that point. But how do you now balance out all these other things that you do to help them to, in order for them to say, for instance, I wean myself of the medication, but because there are all these other things as well that you've made available to me as a patient, I will still be able to survive without the medication? Is it even possible to survive without the medication? But because I still go to my therapy, I still engage in other things, and I'm still practicing all these coping mechanisms. Is it possible that I can wean myself of the medication and live okay?
Not at any point do you wean yourself of any medication whatsoever. So if I feel like I've been on medication for 4 months, and I'm fine, I'm not feeling like the way I was feeling 6 months ago, and so on. It's because of the same medication. Should you stop it, the symptoms will come rushing, probably even harder. than before. So usually what we do when we start treatment, let's say for instance, if I were to start you on mood stabilizers and I go for epilim, for instance, maybe, and I started at 200 milligram, and I see you next month, you still have the same symptoms, you still fine. I go to 300, I go to 400, I go to 500, looking at your weight also and looking at your tolerance. And then I will go to whatever, probably get 2,000 milligram, 1,000 milligram, and then you are fine. It's fine. We stop there. We don't go above that. And if it's antidepressants and probably you come in, they are so severe, you are at 60 milligram and everything goes well, fine. You start attending psychotherapy and you start learning how to deal with these things. It's fine. You can taper down. It's no problem. We can take it from 60 to 40. But you stopping gradually will just do more harm than any good. Because I know, like probably you have a file, I'll know that you are on 60 milligram and you are attending this. We also have feedback from your your therapist who says, this is what we've learned. Isn't it? Like I said, it's a team which sit at some point and discuss, even if they don't sit, but we read each other's notes to know that, okay, this is, I can probably taper down with medication, or I can put more groups in it, or whatever that might be needed. So now we might taper down from 60. Next month we take it to 40. The other month we leave it at 20.
Just don't cut out the
we leave it no. And considering that if you are at 20, you are still functional, the symptoms are not there and all of that, then we can leave it at 20. But should any healthcare professional move from 60 to 40 and you start experiencing the symptoms, then it means we need to go back. So it all depends on tolerance. And you can never say, no, I'm fine, and you stop it. Or it's making me drool, or it's making me have an appetite, or whatever, and you stop. No. Talk to your healthcare provider. We have other things that are in place to counter effect the side effects. You stopping does not do any good to yourself or to your treatment plan. Yeah.
Okay. Thank you. I don't have any further questions. I don't see any from our viewers as well. And we are out of time. I don't know if you've got more for us. I'm always welcome for it. So if you've got more, please go ahead.
No, I think I've covered most of what personality disorders are, what we do in treatment plan.
Yeah.
But should anyone have any questions, even after the live stream has passed, you are more than welcome to inbox for clarity. But what I always ask is that I might have a personality disorder, you might have a personality disorder, and what works for you might not work for me. So it's very important to also avoid taking advices from the street or your Facebook groups, or what we usually see, you find questions on Facebook and people will then come with what what works for somebody else might not.
Or like me, you Google.
Yes. Treatment plan is individualized for a reason, because we might have the same condition, but we have different underlying problems. So you need to, you deal with a person one to person, and it's not one treats all. No, each and every person will then be treated with what they present with and what treatment they warrant, and not because of you gave that other one antidepressant, this one needs to get antidepressant. It might not be the case. So it's very important. If even after this, I know a lot of people will probably diagnose themselves. You don't have to diagnose yourself. You can just sit with a healthcare professional and get a proper diagnosis there. And don't run to Google. Yes, Google will diagnose you with so many things. I know, even myself, whenever I have certain things, I'll Google the symptoms and I'll get something else. And when I go see the medical practitioner, I get it something else. It happens to the most of us. Yes, it's always the case. But remember, treatment is always on individual basis. So, yes, you might have said a lot of things that might make it appear like you are different. Yes, you are different, but that doesn't mean there's something. Yeah. So you are still a person. You're still loved, and whatever situation that you have at that point, come up to get that treated, and let's continue. Yes.
Jeez. Thank you so much, Priscilla. Yeah, we will be calling you back because there are other things that we still need to chat about. Unfortunately, we are out of time. But yeah, this has been freaking awesome. Thank you so much for coming through. I'm not happy though because I could see myself in so many of those disorders.
I think
But thank you for the
each and
knowledge.
every one of us is gonna say, "You got one there,
Yeah.
one there, one there, one there, one there." But if it does not affect your daily living, then
Your
you
daily,
don't have it.
you're still
And
safe.
remember, you can never have all of them. So if you have got one of each, then it means you probably not. It's not it. Because imagine if on the OCD you have one, on borderline personality you've got one, and that doesn't mean you have all of them. No, it doesn't look like that. So at some point, you want things to be done the right way. At some point, you want people to listen to you. It's quite normal. But immediately when it disrupts your daily living, then that's when it becomes a problem. And whenever it's a problem, you deal with that problem. Yes.
Thank you so much, Priscilla. Keep your phone on. Please don't block my calls. When we need you back here to say, look, we are struggling. So please do not block my calls. And thank you so much for joining us. Thank you for the knowledge. It's been awesome.
Okay.
I can't be back again. Yeah, all the best. Thank you.
Thank you. Bye.
Bye. Sure. Okay, guys, that was very interesting. Obviously, it was very insightful as well. She's yeah, I'm worried about myself right now, but she said I must not worry. If my daily activities are not affected, then I've got nothing to worry about. So yeah, me and you are still safe for now. But what I've taken out from that is that we need to take things a bit more seriously, guys. I know a few of my friends or associates and who are patients, and they tend to win themselves or try to win themselves off the medication after a while. We've heard from Priscilla Ogbana, that's not a good idea. So let's just take care of ourselves a little bit more from now on. If you know that you're a patient, please abide to what your medical practitioners are advising you to. And if you've got a patient around you, guys, let's support them. Yeah. And I know that when the session started, we were focused more on being able to assist each other during the lockdown, because now we're feeling a bit lonely and locked up and all those things. And I know from tomorrow things are getting a bit better and whatnot. We can travel, we can go see our friends, we can go to the restaurants and the beaches again and whatnot. But let's continue to take care of ourselves. And Priscilla and I are here all the time. If you've got more questions, if you need assistance, it doesn't matter where you are in South Africa. We will try and assist as much as we can, refer you to relevant people in your area that can assist you. So yeah, next week is gonna be very, very interesting, guys. So we are getting ladies from the spiritual realm of things to come in and tap in on this as well, because we get so many cases whereby I've got a disorder and my family are adamant that Ubabam Kize is the person who will assist me, or Mom Profeta down the road just needs to pray for me and splash water on me and then I'll be fine. So next week we are tackling those. Don't miss out. I know we are physical beings and we get checked by the doctor and but we are also spiritual beings as well. So let's not neglect that part about ourselves as well. So thanks again to Priscilla, wherever she is. That was very informative. Yeah, I'll see you guys again next week, hopefully. Don't miss out. 3 p.m. on Sunday. Goodbye, everyone.